Welcome to the Smile Sisters podcast, powered by the LA Dental Clinic. In each episode of the Smile Sisters, host Dr. Ozzy and Dr. Arazu Nasiri show you how you can transform and maintain your smile. The sisters explain everything you need to know about your mouth and why keeping it healthy is key to your overall health.
Welcome to the Smile Sisters. Today we're going to talk about combining orthodontic work with cosmetic work.
Sure.
And this is a common thing that we do.
Probably, I would say 60% of the cosmetic cases that we do here, we have done some previous orthodontics on the patient, maybe even higher percentage.
Okay.
Some of them come to us after orthodontic treatment and then we do their cosmetic work.
And by orthodontic, you mean what?
So having your teeth moved with braces or a clear aligner like Invisalign.
Okay, so moving the teeth before doing like veneers or whatever else.
Sure, yeah.
So what are the criteria? Like who would need that?
So sometimes people come and say, I don't like how my teeth look. I want my teeth to be more uniform, more symmetrical, more straight. But the issue isn't that the actual tooth is misshaped. The issue is that the tooth is misaligned. That means it's the position, not the shape of the tooth that is not symmetrical, correct? So we're always looking at the cause of the problem that we're trying to resolve. So if the cause of the problem is that the teeth are in the wrong position, then the ideal solution is to move the teeth into the right position.
But who's eligible? Like adults normally don't want to do, like people just want to get veneers like in 2 weeks and be done with it. People don't want to go through braces as an adult.
So definitely instant gratification is a problem, right? So I think 95% of the Invisalign treatment that we do is on adults here at our practice. So we have a demographic.
Wait, is it adults or adults? Just kidding.
I think it's adults.
Really?
Yes.
I think that's the Canadian pronunciation.
Maybe it is, yes. So we do a lot of orthodontics on people who are over 18. Okay?
Yes.
And I think it's totally fine. Anybody can be eligible to do it. There is no age limit, really. If we're considering Invisalign in particular on someone that's older, we're just really looking at what are their gum line looking like, how much bone do they have, and maybe we're going to be moving the teeth a little bit more slowly than in somebody who is, 15, 16, because their bone is just more malleable at that age. The teeth will just move around faster.
Right.
So the treatment might take a little longer. You might have to go a little bit more slowly. But often in adults, you're not correcting the same things you would be correcting in a child. So let's say if you had braces when you were 11, 12, and you had elastics and braces for like 2-3 years, that might not be the same thing when you're an adult.
I think that's a fear, right? It's like people have already done braces as teenagers and they had like all this wires and for 2-3 years, and then now they have to go through it again. Like
Right.
what is involved? It's not as much this time, right?
Sure, yeah. So if you're somebody who had braces as a younger person, in your teens or whatever, and now you're coming in because you want veneers, but the issue is that your teeth have crowded. And this is a common problem that we see. The front teeth start to overlap, especially the lower front teeth.
Yes.
Sometimes the upper front teeth can splay out or rotate out and you get spacing between those teeth. And then you come in and you say, can you veneer this? But if you have teeth that are sticking out, in order to veneer them, we have to shave those teeth down, right? So that becomes more invasive. We can do that to a certain extent, but we don't want to compromise the health of the teeth. So one other thing we could do is just to derotate and tuck those teeth in with something like Invisalign. It's not the same braces you had as a kid,
Right.
where we're trying to move molar teeth and get your jaw in the correct relationship as you're growing. Often braces take a long time as a kid because we're waiting for that growth spurt of the child while the braces are in.
And we're working on the jaw as
Exactly.
well.
The jaw is growing. We kind of have to wait for that growth.
Yeah.
And keep a person in elastics and braces until that growth is finished, so their jaw doesn't take off on us and move more than it's supposed to.
Yeah.
But as an adult, we're not trying to correct that, especially if you had braces as a young person. Your back teeth are probably in a reasonable position. Things tend to crowd in the front. So often it's just doing a little expansion, which means widening your arch so you get a fuller smile.
Right.
And then aligning the front teeth and derotating them into position. So often, if that's all we're doing, it can be a process that takes only 6 months to a year.
For the braces part.
For the Invisalign part, yeah, or braces part for an adult.
Right. And then after that, the teeth are in a better position. Now you can do veneers. And the veneers that you end up doing tend to be a lot more conservative too, right?
Right. So sometimes you don't need veneers afterwards. So if your
Right.
teeth are sound, they look nice, but the only issue with them was that they were misaligned. Sometimes you're just doing Invisalign and then you're done. No need to get veneers. It's actually less expensive. It's much healthier
Much
for you.
healthier.
It looks great, and then you don't have any maintenance,
Right.
other than wearing a retainer at night. But you don't have these veneers that maybe down the line you have to replace, or have to manage in some way.
Right.
So in general, functionally as well, if your teeth are misaligned, if they're crooked and overlapped, probably your bite is not right. You're wearing the angles of your teeth, you're wearing them at weird angles. They're probably chipping and breaking down on you because they're not coming together perfectly well. That means like a lower tooth, if it's sticking forward, it's banging into the edge of an upper tooth, you might get some chipping there. If you align them all correctly, we're looking for balance, as in all the lower teeth hit the inside of all the upper teeth at about the same angle, with the same force. So you don't get the same kind of like
So you
point
don't have like
fracture.
one tooth that's sticking out hitting first. You have all the teeth in a row. So when you bite down, they all hit at the same time.
Sure, yeah.
Kind
so
of
there's,
thing.
There's
Yeah.
balance between the teeth in the back and the front. When you're chewing, you're not catching the corner of a tooth. Things like that cause chipping and breakage when your teeth are crooked,
Right.
basically. You're avoiding that. So you are helping the long-term health of your teeth as well by aligning them.
So something that happens a lot is when people come here and they have these overlapping teeth and they've had it for many years and now they want to get veneers or they want to just fix their smile.
Sure.
Then we kind of like align the teeth, but now they look more crooked.
So you're talking about if the edges of the teeth are worn at different angles. So if your teeth are crooked like this and you've worn them and now one side has been kind of worn to an angle and the other side is worn at a different angle, when you straighten the teeth out, the edges are going to look uneven.
Right.
So we talk about that before we start the Invisalign. So those are the cases where we would do something like Invisalign, align the roots of the teeth, get the teeth in the right position, and then we can do something to kind of correct the edges of the teeth. If it's just some minor little, chipping and unevenness, sometimes all we do is just polish those edges smooth and we're done.
Right.
Often in the lower front teeth, we might do that. If there is more significant chipping or you have older fillings or discolored teeth or anything like that, or you have narrow teeth with spaces that we don't want to necessarily close all your teeth together. Some people have peg laterals, which is like really skinny lateral incisors. These are the teeth right beside your front two teeth.
Right.
It's a genetic thing. Those
Like
teeth are
one
really
tooth
narrow,
is just really tiny.
really skinny. Yeah.
So then if we close the gap, it kind of like throws off the whole arch.
Yeah, it throws off the whole arch, and then your lower teeth don't fit properly underneath the upper teeth
Right.
because the lower teeth are of the normal size. And so in those cases, we will actually plan spaces around those teeth with our Invisalign so that eventually when we do get that veneer on that tooth, it's going to be the right size.
A lot of people have what we call a crossbite.
Think about your lower teeth like a shoebox and your upper teeth like the lid to a shoebox. So the lid should fit over top and sort of surround and overlap the lower teeth all the way around.
Right.
So that is the ideal situation. Sometimes the lid of the shoebox kind of gets wedged underneath the box itself, and that's what we call a crossbite.
And that can cause pretty severe chipping because it's like the tooth is hitting in such a awkward position.
Yeah.
And then when we bring the lid over, that tooth looks like really off all of a
It
sudden.
can, yeah. So sometimes if you have a front tooth that's in crossbite, you have a front upper tooth that's stuck behind a lower front tooth, when you're biting down, the kind of front surface of that tooth can be really kind of worn down or beveled off or chipped off. And then when you slide it forward, then the edge of that tooth is not the same size as the edge of the next tooth. Maybe some of it is worn away. So then you might do a little bit of bonding. So these are the options on your upper teeth. We could just polish if it's just a little bit.
If it's a little bit uneven.
Make everything smooth.
Yeah. Because people do ask me, can't you just like shave it? It comes to a point where you can't just shave it and make it even anymore, right?
So that's
because it can cause like other issues if you just basically like smooth all the edges out.
Yeah, so you want to look at that from a cosmetic standpoint and a health and functional standpoint as well, right? So there is a certain height to width ratio of teeth that we want to maintain. So we call it the golden rule. You know, there's a golden ratio where teeth need to be a certain height compared to the width for it to look kind of natural or the way that we
aesthetically
want it to
pleasing.
Exactly. So your teeth have to be longer than they are wide, basically, by some ratio. So if you have a tooth that's chipped off at the edge and we shave that tooth down and we shave the adjacent tooth down to match it to that level, maybe your tooth's going to look really squat, you know?
Yeah, you have these like tiny little squat teeth. They're all even, but it looks terrible.
It doesn't quite look right in your face. It doesn't quite look right, you know, in your smile. And the reason is that we have impinged on that ratio, you know, and now something's off.
And also it can create sensitivity because we're shaving into the deeper layers of the tooth.
So that's the second level, right?
Yeah.
So first, from a cosmetic standpoint, we're trying to make things better. So if we go and shave everything, and so they're even, but now your teeth look weird. Right. You know, they just don't look right anymore. So that's a problem. And then the second thing is, you know, we have a certain amount of enamel on the surface of our teeth. So our teeth, think of them like an onion. There's layers, you know, there's the inside layer where your nerve is, and then there's this whole layer of tissue called your dentin, which is inside, has nerve endings in it. So when you get a filling, you have to get numb because we're going into this dentin area where you might feel it otherwise.
Right.
And then outside of that, there is that hard shell of enamel, no nerve endings in this area. And that's why when you have enamel over your teeth, you don't have sensitivity. Your teeth feel fine, right?
Right.
So one of the issues is if you start shaving the teeth down in order to match the edges and you remove all of the enamel layer of the teeth, you're going to expose the dentin and cause sensitivity.
Cause sensitivity, impinge on that golden ratio.
Sure.
So you're basically kind of like shooting yourself in the foot because you're not looking good and you're sensitive. So it's not always the right thing to just like smooth them out.
No, and it's remarkable to me how many patients come in and I look at their teeth and go, why are your teeth looking like that? Oh, they were a little longer. This dentist at one time just shaved them down.
Yeah.
And then they impinge on that ratio. So be really careful. And that's a conversation I'm having all the time with patients. They're like, can't you just shave it down to match it? I'm like, look at what it's going to look like if we shave it down.
Yeah.
Sometimes I'll take a black marker and I'll actually paint over the edge of the tooth where we might want to take it off in black. And we can stand back and look at the teeth and say,
that's a good trick.
Is
you
that
can
even
just
going to
like
look right?
Cover it a little
you
bit.
Cover it up and kind of take a look and see. So we definitely are not going to impinge on the dentin, so we can't remove a whole lot of tooth structure. So if it's just a little hair, often it's a nice thing to do because now you don't have to have bonding and manage that over your lifetime. You're done. You just smooth the edges and you're done. You just wear your retainer again.
Right.
Make it as simple as possible for yourself. But if the edge is a little bit longer where we're going to either make the tooth look squat or cause sensitivity or, you know, but just be too invasive.
Yeah.
Then you have options. So the first option is to do a little bit of edge bonding or adding filling material just to the biting edge of your teeth.
So basically, like if your tooth was a certain shape, but over the years it became like slanted, you could just basically like refill that corner where there used to be tooth structure and just make it look like the tooth used to look like before.
Yes. Yeah, you could do that. If you want to sort of recolor the surfaces, make the teeth look more uniform, lighten the color in general, just make everything look kind of clean and good. If, let's say you had old fillings on your teeth, you have some cracking, you have some staining, old restorations on your teeth, what you can do is get bonding or composite resin veneers over the surface of all of your front teeth.
Right.
Okay.
So this is veneers.
This is composite veneers. Yeah.
Right.
Or you can do it in porcelain, and that's porcelain veneers. So you have a lot of different options of what to do to restore, and it's going to matter, you know, what your goals are. So what do you expect this to look like at the end, and what your situation is at the moment.
Right.
So that might help you decide.
So let's talk about the least invasive to the most invasive. So first step is get the teeth in the correct position. That's the least invasive thing we can do, is just put the teeth in the correct position.
Yes. The first thing that you want to do is decide what is the cause of the problem, right? So
Right.
if it is a positional thing, if the teeth are in the wrong position and you're eligible to get Invisalign or braces, and you can give yourself 6 months to a year to get this corrected, that's definitely the option that I would choose. Sometimes we know at the beginning that we're going to want a veneer or do something over the teeth after, because we already know, okay, they're in the wrong position, but the edges are also chipped, the teeth are also discolored. So we can plan the orthodontic work along with the cosmetic work.
Right.
So if I'm going to do that, knowing that I'm going to veneer the teeth later, I'll actually position the teeth slightly inclined backwards, so that I can put the veneers on top of them without having to cut into the teeth.
Right. So you create space for the future veneer by moving the teeth a little bit more in than would be ideal, let's say.
Yes. So then really I don't have to cut into the teeth in order to put the veneers on. So it becomes really non-invasive. It's a great thing to do.
Yeah.
The other benefit of doing the orthodontic work is spacing the teeth correctly. So sometimes people come in and they have like a skinny tooth on this side, like the peg laterals. The other side is a wider tooth, but their space is closed. So with Invisalign, I can actually make room. So I'll figure out, ideally, what do we want this tooth to look like at the end of treatment? How wide do we want it to be? And then what I will do is I will leave exactly that amount of space around that tooth, so that later we can veneer it and match the size of the tooth on the other side.
Right.
So we can actually make these decisions at the beginning.
So you can like pre-program the movement with the cosmetic work all before doing a single thing to the person. So you can have it all laid out. But it does take longer. It takes about a year and a half to finish, rather than just doing straight veneers.
The other thing to consider is the gum lines. So if you have teeth that are crooked, the gum lines are also going to be not in the right position.
Right.
So think about the gum lines that surround the roots of your teeth, like the window dressing, like the curtains that surround your window, right? So those also need to be kind of symmetrical and positioned right. When we have two teeth that are aligned properly, the gum lines are the same. But if we have a tooth that's more inclined forward, the gum line of this tooth is also going to be higher up. If we have a tooth that's inclined back, the gum line is going to be lower down. And so that creates this unevenness. So when we move the teeth orthodontically, as well as putting the teeth in the right position, I'm looking to put the gum lines in the right position.
Right.
And that makes it easier to then do veneers that look the same, that are the same length.
That everything looks even.
Looks good in your smile, that you don't have a tooth that's, you have a high gum line here and a low one on the other side.
Yeah. Actually, that's something that's overlooked a lot, is the gum. And that's something that can make a huge difference in the final cosmetic outcome.
Oh, it's massive. Yes.
Yeah.
And so people learn to not show their gum lines or their teeth when they smile, because they're conscious of this issue in their own mouths.
Right.
So we're looking to correct that.
That's a huge problem with those old kind of like silver crowns that had that dark edge. And, the tooth looks fine, but then right at the edge of the gum is like a dark spot or something. That can make a huge difference in the aesthetic of your whole smile. So it's a big deal. So a lot to think about if you just want to get veneers, quote unquote, is mainly first you want to look at the position of the teeth. Before you start drilling your teeth and getting veneers, first you want to put them in the right position.
There's so many nuances and layers to this. People will call and say, how much for veneers? I'll be like,
There's so much to think about.
There's so much to think about, yes. So, and that is the issue I have with people flying out of the country, sight unseen, going somewhere and having them just, put veneers over their teeth and sending them back without having looked at them at all. This is really even the correct thing to do for you to start with.
Right.
The healthy thing to do for your gums. We haven't talked about all of the other parameters that need to be met for this to be successful. Our goal is you get cosmetic work, it's going to last you 10, 20 years plus, without you having any further issues.
Right. I think in another episode we talked about people who come in constantly with veneers popping off and chipping, and because a lot of these parameters have been violated.
Yes.
So the whole system is not functioning correctly.
Definitely. Yeah.
Yeah. If you want to get veneers, you can go to our website, ladentalclinic.com, and we will consider all these parameters.
And
We
maybe
will,
suggest orthodontics for you
yeah,
instead.
it might be. Yeah, it might be the only thing you need, really.
Exactly.
Yeah. Okay, see you next time.
Bye.
Thank you for listening to the Smile Sisters. If you found this episode helpful, subscribe and leave us a review. To book a free consultation, go to ladentalclinic.com.